Welcome to Socially Served. I'm your host, Frank Sroka. And as you know, Socially Served was created to provide consumers with informed decisions. And today we're on location at Toronto Western Hospital with Dr. Buckley of the Addictions Program. And we're going to speak to her about some of the programming here at Toronto Western Hospital. But before we do that, we have a very important message from our sponsor. So don't go away. We'll be right back.
Equitech Employment Equity Solutions is Canada's #1 subscription-based outreach provider. Equitech's outreach network takes your employment posting and job information and distributes it directly to over 800 outreach partners nationally. Driving the qualified candidates you're looking for right to your door. So why not connect to the largest diversity broadcast portal and be a part of Equitech's diverse and comprehensive outreach strategy today. Check us out at www.equitech.ca. Socially Served is sponsored by Equitech Employment Equity Solutions.
Welcome back, and we're here at Toronto Western Hospital with Dr. Buckley from the Addictions Program. And I'd like to welcome you to our show. And
Thank you, Frank.
Yeah, you're quite welcome. And I kind of wanted to talk about a little bit about the sense of early intervention, sort of the process of how do we identify if someone self-identifies an addiction, how do you go about assessing them and trying to assist them towards recovery?
So that's a great question, and you mentioned early intervention, and that's something that's very important to us. So
Right.
working with people who have substance use disorders all the way through the spectrum from early to late. When we see people who are really, really struggling in the late days and maybe have had a lot of consequences, we always wish that we had seen them earlier on. So
Right.
maybe we could have helped them earlier, and maybe some of the struggles that they've had would have maybe not happened. So when we work, those of us who work in addictions really, of course, like it when people come in earlier, because it's also a little bit easier to work through the problem when it's earlier days.
So how do you get that individual to come in earlier? Now that's the challenge for sure, right?
Yes.
So is it an education piece? Is it an awareness piece? How do you go about that?
So I think a lot of people don't really know where to go.
Right.
When they are wondering if maybe they are losing control of a substance, and maybe through media or TV or movies we get an idea of what treatment is like, and maybe don't really know that there are options and different kinds of treatment that people
Right.
can get. So they might imagine, for instance, that they have to go away to rehab and leave their family or their job
Right.
for a certain amount of time, and that may keep them from actually looking for treatment. So people might not be aware that you can receive outpatient treatment, meet with somebody once a week to talk about your substance use, and of course, as you mentioned, you can even meet before you're sure you have a problem. So we can talk a little bit about what maybe some red flags would be, but if somebody is thinking that maybe substances are getting in the way and that they're having consequences from their substance use, maybe that's a better time to come in and meet with us, and
Okay.
maybe we can help them decide whether they do have a problem.
So maybe you want to share with our viewers sort of what are these flags you're talking
Sure.
about? So how can they identify that?
So we, talk about a few different maybe red flags that are important. So one is often that others may suggest to you that something is going wrong, and that maybe your substance use is getting out of control, or maybe you're having problems because of your substance use, and other people are recognizing it,
Okay.
but you haven't recognized it yet.
Okay.
So friends, loved ones might mention, family members.
So
might
is that
mention
sort of
something.
an issue? Could be like, is it a lot of self-denial though? Is it that the struggle, like, or is it sort of a point where you kind of say, okay, now I recognize, because actually that individual has to do the action, right? They have to
Yes.
accept it and do the action, right?
Yes.
So
So it's a great question. So denial is something we talk about a lot
Okay.
in treatment, and sometimes somebody really doesn't think they have a problem. Sometimes maybe they do recognize they have a little bit of a problem, but they really don't want to address it
right.
because they're afraid of what that means, and they're afraid to actually stop the substance. So there's some, sometimes people are completely unaware they have a problem. Sometimes they're a little bit aware,
Right.
but they don't really want to stop. And so
Right.
I think we call both of those denial, but they do both of those processes get in the way of somebody actually getting treatment and seeking help.
So for instance, they come to your office, they have a session to talk about their addiction, or it's like a learning education piece where they need to understand what's happening to their bodies, maybe, what's going on in their environment, how it's affecting other people. Is that sort of what?
Yeah, so that's, sometimes that happens before someone comes for treatment,
Right.
where others will come in and do an intervention.
Okay.
Certainly popular on TV with shows
Right.
like Intervention,
Right.
and really help somebody see what the substance is doing to them and their friends and their loved ones. And sometimes that leads to the moment where somebody, does shift gears, or, within themselves they think, okay, well, I've had problems controlling my use. I have friends and loved ones telling me that I'm drinking too much. I
Right.
look at the numbers, of drinks I'm having a week, and I know it's high, and I am worried about my physical health. Maybe it's time that I actually, will go in to see someone and talk about it.
So they assume they go through that phase, they identify that. So then what happens? So they come speak to you, they then realize, I most likely have an addiction. So then what happens?
So we have a team of counselors,
Right.
and generally when someone comes into our regular outpatient program, they'll have an initial assessment, an interview, and so we talk about so much, so it can be a very long assessment. So we really want to know everything about someone's life. We want to know, exactly what has sort of led them to be concerned. We'll ask them questions about their substance use and numbers and frequency, and then we'll ask about consequences. And sometimes people may not have thought about consequences that
True.
we do bring up, so we have a long list
True.
of different questions.
True.
And we also really want to get to know the person.
Mhm.
So we ask a lot of questions about someone's life, growing up, what that was like. So we get a bit of an idea of what sort of the whole span of their life has looked like.
Mhm. And when you're saying addiction, so we're just not alcohol addiction. It's all sorts of addictions, right? So is it?
So there are a lot of addiction is used for a
Right.
lot of different things
Right.
today. In our clinic, we work on what we call chemical addictions, so
Okay.
substances.
Okay.
So often use the term substance use disorder,
Okay.
which could be, the most common substance we'll see is alcohol.
Okay.
We'll see cannabis, marijuana, pot, cocaine. Sometimes we'll see prescription medication.
So with the recent sort of opioid crisis that are happening
Yes.
now, it's a question of identification too. I think too, like education in terms of even with the your family physician. I mean, just identifying that there's issues, or knowing how to cope with those issues. That could be that could be itself a problem, right? A bias, right?
Yes.
Yeah.
Sometimes people don't want to tell their family physician about a substance use
Right.
issue they have, because number one, it might involve a prescription that doctor has given them, or they just may feel like they don't want the family doctor to know that they have that substance use issue.
Mhm.
And it's important to remind everybody that that is sort of an issue that doctors treat, and encourage people to share openly, because the physician may have good ideas about resources that one might not be aware of, and they also might be able to look at medical conditions that could arise from the substance, and just
Mhm.
make sure that the person is healthy.
So that there is really, so it's important also to understand that there is really not a cost to the treatment, or like, because I understand with the Toronto Western Hospital we did a pre-show previously.
Yes.
And it's so interesting the holistic approach that Toronto Western has in terms of assisting individuals. You have Divine Divas group, the acupuncture group.
Yes.
Just so different, but yet very effective.
Yes.
So that's all sort of part of the, I guess, getting the person back on track and into recovery, right?
Yes. So we try to offer, we have straight up counseling, but we do also have groups, and try to use think of other ways to get people treatment or tools or resources that will help them.
Excellent. So we're going to take a little break right now, and we'll be right back with more information on the program. So stay tuned and don't go anywhere, because we'll be right back.
Equitech Employment Equity Solutions is Canada's #1 subscription-based outreach provider. Equitech's outreach network takes your employment posting and job information and distributes it directly to over 800 outreach partners nationally. Driving the qualified candidates you're looking for right to your door. So why not connect to the largest diversity broadcast portal and be a part of Equitech's diverse and comprehensive outreach strategy today? Check us out at www.equitech.ca. Socially Served is sponsored by Equitech Employment Equity Solutions.
Welcome back to Socially Served. I'm your host, Frank Sroka, and we're at Toronto Western Hospital with Dr. Buckley. Talk about the addictions program here at the hospital. Welcome back.
Thank you, Frank.
And we were speaking a lot about the education process, being aware of addiction. So, how does one go about understanding what really happens to their body during an addiction process?
Thank you for asking that, because I think it's really important for people to understand a little bit about the process and how it happens and why it happens. And every substance that we tend to use, that we misuse, comes into the brain to its own unique receptor. So whether it's cannabis or alcohol, it finds its way in, comes to the receptor, and then it finds its way to the reward pathway. So
Right.
every substance, no matter how it comes in, it will. The reason it's a substance of abuse is because it makes the reward pathway fire. So the reward pathway involves the nucleus accumbens, which is just like a pea-sized organ in the brain, and it's responsible for creating pleasure, the feeling of pleasure. So whether it's eating delicious food, or having a drink when you're
Right.
thirsty, or getting a hug, or having a laugh with friends, when you feel pleasure, it means that your reward pathway is firing.
Okay, little synapses are firing, right?
Little, yes,
Yeah, little nerve things.
and it's a very important pathway
Okay.
because it makes us
Okay.
feel good.
Right.
And so when substances are coming in, we say they hijack the reward pathway because they make the reward pathway fire, and they make it fire powerfully. So when somebody is using a substance
Right.
over and over again, they get used to the reward pathway firing,
Right.
and it feels good. And over time, sometimes you start to only think about the substance because it's maybe the most dependable. It's such a powerful reward compared
Okay.
to what our usual life experience is, that sometimes people talk about like almost getting into a tunnel where the only thing that matters
Is that reward?
is that reward, because your
Okay.
brain is getting used to that reward, and you want that reward to keep firing. And other things in your life, like your friends or your family, they're not creating the same powerful reward. So they start to sort of go into the periphery, and all you're thinking about is the substance that dependably makes your reward pathway fire so
Okay.
strongly. So that explains in some ways why we seek out substances, because they make us feel good.
So how do you alter that pathway of reward?
So at the same time that reward pathway is firing, and this is
Right.
where we really get into trouble, is that there's learning that's going on. So when you get a reward in your brain, you remember that,
Yeah,
and there's
the
some
mind is
learning.
mapping it all out.
It's mapping
Right.
it out,
Yeah.
and it's attaching. So
Okay.
we use a word called salience. So something becomes more important. So if you think about having your first coffee, you're just like, oh wow, this,
Right.
it makes your reward pathway fire. And if you have it every day, over and over again, then all of a sudden you're attaching to coffee. You're attaching to maybe you have a favorite coffee cup. So you attach to the things around the coffee, favorite
Guilty.
coffee store. Yeah, guilty, very guilty. And, so the coffee
yeah.
has become what we say salient and important.
Right.
And so when we think about someone who's struggling with a substance, they'll say, it's just constantly popping into my mind. So it's so salient. So if it's a prescription medication and someone walks by a pharmacy, it's just ding, the hair on the back of the neck goes up. It's very, very close and present and powerful because it's been linked over and over again to this powerful reward.
So how do you alter that?
How do you alter that?
Yeah.
So, I think that's the biggest challenge
Mhm.
is we can sometimes control the reward through different
Mhm.
medications, make the reward less,
Mhm.
but it's much harder to control all that learning and attachment that's happened.
It's behaviors, right?
Behaviors.
Behavior patterns. Okay.
So that's why, sometimes it takes a lot of treatment and a lot of thinking and planning and tips and tools to really get away from that powerful, powerful thought.
Right.
And, in some ways, people can compare that attachment in a way to love. So, imagine if, why does the thought of a drink keep coming into my mind, right? So someone's like, why won't it just, why do I have to have this obsession?
Right.
Because then I could, then I wouldn't have this problem.
Right.
And so we can't control it, just like we can't control love. So that person just might keep coming into your brain and, sort of, even if you're not planning to think about it, whether it's, or even food, right? So a favorite food might come into your mind and be like, oh, yes. It would be nice to have that right now. So just like when something just won't just won't leave you, and you're always thinking about it or wanting it, that's when you know that you're starting to struggle.
So moving forward, so once that individual realizes what they're dealing with and they have the tools that you provide them to deal with that addiction, they move towards a pathway of recovery. Well, how do you maintain that? That's
Yes.
a struggle in itself.
Well, those are all great words, right? So
Yeah.
I love the word recovery because we have to change sometimes so many things
Right.
in our lives when we want to make a big change, like stopping a substance is a very big change. So sometimes you have to change who you're spending your time with. Sometimes even a career can be difficult because it creates an environment where substances are always around. So sometimes you really do have to remove yourself from certain exposures that are difficult. And everybody finds a different way into substance use disorders, and everybody has to find a different way out of it.
Yeah.
So everybody's unique and is going to have a unique plan going forward and their own sort of unique recovery.
So do you build this plan with the patient then?
So-
Is it a buy-in from everybody, right? Like this is my plan. This is how I'm going to maintain myself.
Yes, and sometimes
Yeah.
we don't know until we start trying.
Right.
So of course we have a lot of resources that we
Right.
things that we've used in the past and suggestions, but they're all just options
Okay.
that we present to someone, and
Okay.
then they
Yeah.
usually know what will work, or they'll try something
Good.
to see if it will work.
Because we're all individuals, all different personalities.
Yes.
So tell me a little bit about success stories. Success stories.
Success
We want to hear
stories.
success stories.
We are so, we're always thrilled when we see somebody do so
Yes.
well.
Yes.
I saw someone this morning who was a great success story.
Awesome.
And yes, whenever that happens, usually we share,
Sure.
care. So other people have worked with this person as well. So it's always lovely when we can, tell someone about a person that we used to see and how well they're doing. So we certainly see people do well.
Excellent. So moving forward, so with your whole program, any information that we need to know or the viewers need to know?
Yes, so we are a self-referral program. So, if somebody is looking to start to make a change, they can self-refer to us via phone.
Great.
416-603-5774.
Okay.
And that starts the process, so it doesn't require a doctor's referral,
Perfect.
which is unique.
Perfect.
We do that just so that it's a little bit easier to access.
Mm-hmm.
And then at a certain point, if we are prescribing medications, then of course we're in communication with your doctor. So we do that just to make it easier to access.
So is it available for anyone within the city of Toronto, or is there a certain catchment area or
So we're not catchment.
services? Good.
Yeah,
Perfect.
We're not catchment. Yeah.
Perfect.
Yes.
Okay. So I'm really so pleased that we had this chat today, learned a little bit more about your programs, and would like to thank the viewers for watching. And you gave them the information. You want to give out that number again, perhaps, for our viewers?
I'm happy
Yeah.
to. 416-603-5774.
Excellent. Thank you so much, Dr. Buckley, for joining us today.
Thank you, Frank. It's
Yeah.
such a treat to work with your program.
Thank you. So thank you for joining us on Socially Served, and we hope to see you next week. Bye for now.